Hello, and thank you for joining us. Welcome. Good morning to those in the United States, and I guess it's good evening to some of our speakers and viewers in other parts of the world. Thank you for joining us today for this important discussion organized by Arab Center Washington, D.C. to discuss the impact of COVID-19 in areas of conflict and war-affected and refugee populations in the Arab world, particularly focusing on Libya, Syria, and Yemen. My name is Tamara Kharroub. I'm the Assistant Executive Director and Senior Research Fellow at Arab Center Washington, D.C. I would like to welcome you all for the next hour and 15 minutes or so for this discussion. First, I would like to start by posing some questions for the conversation and for our panelists here. The first set of questions has to do with issues of rights and access. So what is the current state of human rights, justice, and access to healthcare in these countries? How widespread is COVID-19? And what are the prospects for a massive outbreak or outbreaks in these countries? How have the country's healthcare systems been impacted by conflict? And what is the scope of health services available to different segments of the populations, be it refugees in crowded camps, political prisoners, marginalized communities, and so on? The second set of questions is related to the conflicts themselves and the political dynamics. How have the conflicts changed due to the pandemic? How are the regimes and warring factions responding to the health crisis? And how will the threat of the coronavirus pandemic impact conflict and humanitarian conditions in these three countries, Libya, Syria, and Yemen? And the third and last set of questions involves policy recommendations. What are the implications and potential outcomes of the recent calls for a ceasefire? We heard the United Nations call to put armed conflicts on lockdown during the pandemic. Recently, I think today, there was a call by world leaders led by French President Macron for a worldwide ceasefire. Are we to expect any major changes as a result in those countries? What are the policy recommendations that can affect universal access to quality healthcare and ultimately maybe some diplomatic resolution? And how should the policy of the United States towards these countries be shaped under the current conditions? To answer these questions, I have with me today an excellent panel of experts. Thank you all for joining us. I will introduce them in speaking order. First, we have Noha Aboueldahab joining us from Doha. Noha is a fellow at Brookings Doha Center, and she's an award-winning specialist in transitional justice in the Arab region. Yara Asi is a lecturer of health management and informatics at the University of Central Florida. Her research work looks primarily at health, education, and development in war-affected populations. Afrah Nasser, who's joining us from Sweden, I believe. She is a Yemen researcher at Human Rights Watch, and she's also an award-winning journalist, Yemeni journalist. Joost Hiltermann is joining us from Brussels. He is the program director for Middle East and North Africa at the International Crisis Group. Thank you all for joining us and taking the time to speak to us today on this important topic. I will be giving each of the speakers about 10 to 12 minutes to present their prepared remarks. And after that, we will take some questions from the audience. Just to remind everyone joining us today, for those joining over the Zoom platform, feel free to send your questions through the Q&A feature of the portal. Those watching online on our website, arabcenterdc.org, you can send your questions to the panelists by email, and we will look at them to events@arabcenterdc.org. When asking questions, please remember to identify yourself, present the question clearly and briefly so we can get to as many questions as possible, and indicate if you're addressing the question to a specific person on the panel. Thank you again to everyone for joining us. And with that, we'll get to the discussion. I will turn back to the speakers, and I would like to start with Noha. Noha, looking at this from a rights-based or a justice approach, as many of us are aware, people in these areas of conflicts and civil wars were already facing repression, human rights abuses, and humanitarian disaster. Now adding COVID-19 to the mix, what additional difficulties or abuses are we seeing or expecting to see? And what is the state of equal access to healthcare and human rights in these or among these war-affected populations? Noha.
Okay, thank you very much, Tamara. Thanks to the Arab Center in Washington for inviting me to join this talk. I will get to these issues about rights and justice in a minute. Excuse me, but I thought I would begin by sharing just some general reflections on what the coronavirus could mean for conflict and conflict resolution in the region. And then I will end with some brief reflections on this issue of justice and the coronavirus. I think at this relatively early stage, of course, there are more questions than answers, but I think a couple of issues are worth looking at more closely now, especially these calls for a global ceasefire and the calls that we see for global solidarity. So when we look at armed conflict, it's generally confined to, you know, a certain geographical area, right? I mean, no matter how many external actors you have, the death and destruction and the fighting is generally confined to certain geographical areas. And as we now know all too well, the coronavirus knows no boundaries. And so does the transborder nature of the coronavirus mean, could it mean that conflicts and conflict resolution in places such as Libya and Syria and Yemen will draw more international attention? Well, okay, so we've seen these calls for global solidarity. We've seen the Secretary General Antonio Guterres call for a global ceasefire. And all of these calls have gained quite a bit of support. But let's imagine a scenario where the coronavirus is eradicated from the entire world, except for, say, in Yemen. Let's imagine that Yemen is the last place on earth where COVID-19 remains active. How would the world react? Will the world advocate for, you know, health support and an immediate end to the armed conflict in Yemen in order for the country to be able to fight the coronavirus? Or will the world sort of be content with, you know, a lockdown in Yemen, the complete closure of its borders, perhaps an even more restrictive blockade than the one that's been in place there for several years now, in the hopes that the virus will just sort of kind of resolve itself so long as it's confined within the borders of Yemen. I'll come back to this in a minute, but these calls for global solidarity that we see are of course important, and we see these heartening stories about humanitarian solidarity, whether it's the Cuban doctors who, you know, went to Italy and other countries to help treat coronavirus patients, or even the UAE sort of sending humanitarian aid to Iran. But I remain skeptical that the war profiteers, including perhaps especially Western governments that make quite a bit of money in arms sales, will heed these calls or take these calls for a global ceasefire seriously. And we must also remember that even solidarity is highly politicized and heavily manipulated. And again, Yemen is a pretty good example here. The unilateral ceasefire that the Saudi-led coalition declared about a week ago now, on the face of it, of course, is very good news, right? Now, the Houthis haven't exactly been adhering to it, and a lot of the fighting has continued, if not even intensified. But let's consider for a moment how such a ceasefire could be quite a good PR stunt for a warring party such as the Saudi-led coalition. So by declaring a ceasefire to help stem the spread of the virus, the Saudi-led coalition attempts to appear as having a humanitarian sense, right? To heed these calls for a ceasefire. But where was this humanitarian sense for the past 5 years of war in Yemen? Where was it when report after report published astonishing statistics about mass starvation and other disease outbreaks that affected millions and continue to affect millions of Yemenis? Where was this humanitarian solidarity when both the Houthis and the Saudi-led coalition have been busy bombing health facilities in Yemen for the past few years? So why would the Saudi-led coalition and the Houthis agree to a ceasefire over coronavirus, but not over cholera or diphtheria or the measles or famine? Basically, it's about the image, right? It's about showing the world that while they may be fighting a war, they still have a sense of humanity and can decide to kind of stop the fighting to help stop the spread of the virus. But that's only because the entire world is affected by the coronavirus. And while I, as well as many others, would like to think that a crime against humanity in one part of the world would shock the conscience of humanity the world over, the fact of the matter is that it doesn't. Unless it has a direct and immediate impact on other people around the world. And in this case, of course, it's kind of the case with the rapid spread of the coronavirus. And so the key difference then is that pre-coronavirus, these atrocities and disease outbreaks as a direct result of the war in Yemen only affected Yemenis. And so the urgency of a ceasefire in Yemen didn't have enough, didn't grab the attention of enough actors within the international community. But also, of course, we need to think about, Saudi Arabia and the UAE are also confronting a major task in fighting coronavirus at home. And we know that the Saudis have been wanting out of this war for a while now. It's financially costly, and they haven't exactly achieved the mission that they set out to achieve within a few weeks of launching the war 5 years ago. So will the coronavirus be the face-saving exit that the Saudis need to pull out? Maybe, maybe not. And of course, this is a very complex question, and I'm not going to delve into it further now. I'm sure Afrah will touch on some of these issues later. So a couple of overarching sort of questions emerge. Will the pandemic present an opportunity for warring parties to cease fighting and coordinate efforts to contain the virus? Or will the pandemic exacerbate tensions, exacerbate polarization, exacerbate conflicts? Will it create new conflicts where conflicts didn't exist before? And I would say the answer to all of these questions is yes. It will do both, and in some ways it already has done both in this region, but in other parts of the world as well. We've also yet to see a UN Security Council resolution declaring the coronavirus, a threat to international peace and security. This is in contrast to previous Security Council resolutions about the Ebola outbreak and HIV/AIDS. Of course, there's a lot of political squabbling between China and the US. But one thing that we do know in all of this is that the coronavirus has, of course, served as yet another pretext to curb human rights. While many governments are putting in place emergency powers and emergency laws to mitigate the crisis, a lot of governments are also using this as an opportunity to impose very restrictive measures, mass surveillance being quite a popular one. And in conflict-affected countries in particular, where you have tens of thousands of political prisoners and other types of prisoners in cramped, dirty jail cells with no adequate access to healthcare and the impossibility of physically distancing themselves, this is also, of course, this issue of the prisoner release has become huge for some very good reasons. And while we have seen several governments in the Arab region that have released prisoners, not enough has been done there yet. And it's very telling and, of course, unsurprising that the release has been highly selective. So the thousands of political prisoners have yet to be released. And to make matters worse, those who have been calling for their release are also being arbitrarily detained for doing so. And so this is just one example of how the emergency powers invoked by governments, whether they are in conflict countries or not, points to the use and abuse of a public health crisis to pursue repressive policies and entrench authoritarian rule. Which brings me to my final point about the mass reckoning that will need to take place once this pandemic subsides or begins to subside. We know that in addition to the injustices faced by the political prisoners, for example, or any kind of prisoner, that there are many grievances and injustices faced due to inequality, multiple forms of inequality, structural inequalities. We knew that this pandemic has exposed so many structural inequalities that, of course, we already knew existed, but it has exposed them in such a powerful way, such a disturbing way, and it has exposed a lot of these inequalities in some of the richest countries in the world, including in the US. And this is why we see, for example, Ocasio-Cortez and others calling for reparations for Black and Brown communities who have suffered disproportionately from the virus. So given the global nature of this virus, is very likely that we will be seeing truth commissions and other pursuits of justice to address the grievances, not just at the domestic level, but also at the bilateral level and the multilateral levels. Immediately after this virus hit European countries and the US in particular, we saw this rise in war talk, right? This obsession with war analogies. The coronavirus is a war enemy. The ventilators in New York have been compared to missiles in a war. Trump and other leaders, calling themselves wartime presidents. Calls on China to pay reparations in much the same way that Germany did after World War II, etc. So these kinds of war analogies are not helpful, and in fact quite harmful, and they detract from the much more important issue at hand, which is, of course, first and foremost eradicating the virus, but also they detract from understanding how and what to do about the social, political, economic, and public health systems that were in place and that failed to help us better prepare to contain the virus and to stop it from causing so much death and disruption. Before I conclude, despite my initial remarks about my skepticism about how these global calls for solidarity will play out in reality, especially in conflict countries, the work of civil society, local and international, remains absolutely crucial. And those civil society actors who have been working in conflict zones, Libya, Syria, Yemen, of course, being no exception here, have quite a bit of experience already in working within crisis environments and in effective documentation of violations using digital technology, and in laying the groundwork for future sort of accountability efforts to take shape. And I think therein lies part of the global solidarity in action with civil society actors, whether they're in the Arab diaspora or in their home state. I think that is where we can find some hope in a genuine kind of solidarity that will not simply disappear once a certain group of people or countries are no longer threatened by the coronavirus. So I'll end my talk there. Thank you very much.
Thank you, Noha, for your remarks, and I'm sure we'll get back to you during the Q&A session. I would like to remind everyone watching that you can send your questions anytime. Those watching via the Zoom portal, there's a Q&A feature that you can use to send your questions. And those watching on our website, please feel free to send your questions to the email address events@arabcenterdc.org, and we will be taking your questions after the speakers present their remarks. And with that, I will turn to Yara. Yara, as we know, the violent conflict, the repression, and widespread destruction in these countries that we're talking about have resulted in failing healthcare systems, shortages in medication and medical equipment, and unequal access to medical care. And when we consider the millions of refugees, migrants, and internally displaced populations, what do the healthcare systems look like in Libya, Syria, and Yemen? What are the numbers of confirmed cases of COVID-19 or the numbers of death? Are we to expect a widespread outbreak? How would that look like? And how will the healthcare systems be able to handle this pandemic?
Yeah, well, thank you to the center and Tamara for inviting me, and to the audience for tuning in while we're all kind of self-isolating. So I hope everyone is safe and healthy. So just to quickly answer those questions, Tamara, the prognosis is very poor in these countries. So just to situate anyone who is not typically looking at these issues from the lens of global health, I thought I would first discuss the characteristics of health systems in fragile states like Libya, Yemen, and Syria that are relevant to all three of these cases. Then I'll discuss the health infrastructure in these states. And then lastly, I'll talk about how they're equipped or not equipped to deal with the specific threats of COVID-19. So these three countries that we're focusing on today are among the most fragile and least peaceful in the world, not just the Arab world, but broadly speaking. In these environments, threats to health can come from direct violence. You know, that's what we see on the news, the bombings, the shootings, the gas attacks, and the like. So it's very easy to understand those acute health needs because they're so intimately related to the violence of conflict. Libya, Syria, and Yemen have all experienced high and sustained levels of this type of violence and trauma-related injuries. But then there's the indirect violence of war. So there's malnutrition or starvation from blockade, the mother who dies in childbirth because her birthing attendant got stuck at a checkpoint, the lost jobs and the freezing winters and the contaminated water, and on and on and on. So we see increases in deaths from preventable infectious diseases because vaccines were not available, like measles, for example, and increased mortality from non-communicable and chronic diseases like cancer, heart disease, type 2 diabetes that are otherwise treatable just because of decreased access to care and pharmaceuticals. Doctors and nurses flee or they're threatened or killed, which leaves some areas completely underserved. And conflict-affected states, not surprisingly, also report high rates of mental trauma like post-traumatic stress disorder, anxiety, depression. So I think it would surprise some people that this indirect violence is the primary cause of death in most contemporary conflict. More people have died in Syria from the destruction of the healthcare system than the active violence, in part due to more than 500 attacks on healthcare facilities just between 2016 and 2019. While more than 100,000 people have died in Yemen due to conflict since 2015, it is estimated that more than 85,000 children under the age of 5 died from starvation in that same time period. In Libya, instability and porous borders have allowed human trafficking, slavery, and violence to proliferate. But the number one cause of death, of premature death in Libya, is still heart disease. So it's clear that in such conditions, the bombings and the other attacks could stop tomorrow, and there would still be significant conflict-related mortality simply because of the breakdown in services. And in a pandemic environment, you need a pre-existing robust healthcare system to have any chance of effective response. I mean, just look at how the developed world is faring right now. Nobody really seems to have gotten a handle on it, and these are the best case scenarios. Other threats to health in these kind of countries include a debilitated healthcare workforce, either because nobody can get to a medical school or hospitals and clinics are attacked. There's shortages of all medical supplies, all medications, all vaccines. Fear of being attacked or bombed keeps people in their homes, and so they're afraid to travel for even preventive care. As you mentioned, there's large refugee and migrant populations, which even in these vulnerable environments are even more vulnerable and underserved because the states often don't really see responsibility for them, and that increases their risk. You see an increase in gender-based violence and exploitation, which is often hidden or worse, accepted, which increases as women's health deteriorates. So think of basically anything you need to live a healthy life. It's all lacking in this environment, the conflict-affected environment. So war is a social determinant of health in this way, especially in these protracted long-term conflicts like Libya, Syria, and Yemen. They're also highly militarized states, so they have put a lot of emphasis on security and military, but have historically underfunded public health. So there's different coalitions and militia groups fighting for power. They see a chance to gain legitimacy with populations by providing health services that the state can't or won't. And I suspect we will see some of this in countries as this pandemic plays out. And I think we've already heard some initial reports of that. So now moving on to the three specific environments rather. All three of these countries had health systems in well before the coronavirus. Perhaps none more so than Yemen, so I'll start there. Yemen is a country of nearly 30 million, and the UN reports that 2/3 of these people, so nearly 20 million people, do not have access to basic healthcare. Yemen is one of the poorest countries in the Arab world, and in fact in the world, period. Evidence shows that infant and maternal mortality were already rising a decade ago, before this latest conflict began in 2015. And in global health, these are general indicators that can be used as almost as a proxy to understand how a health system is functioning more broadly. So in Yemen, all the signs were well blinking red before COVID-19. Yemen also has a not so distant experience with infectious disease, including the worst cholera outbreak in modern history that started in 2016. It infected more than 1 million people, as I think Noha referenced, and they were just beginning to see a decrease in cases at the beginning of this year. So the timing of COVID-19 could not be worse. And lastly, Yemen has experience with coronaviruses prior to COVID-19 because they had cases of Middle East respiratory syndrome coronavirus, which we hear as MERS, in 2014. But that was much less contagious. With regard to Libya, just a decade or so ago, they were seeing some successes in health outcomes, especially in a region, the Middle East, which is again notorious for undervaluing public health. They ranked higher than wealthier neighbors like Algeria and Egypt in terms of life expectancy. They were seeing reductions in infant and maternal mortality. They were providing free basic healthcare to all citizens, and most people in Libya could have access to clean water and sanitation. Today, an estimated 4 million Libyans out of a population of less than 7 million require health assistance. You have faucets running dry because water facilities are bombed. In just the past 2 months, 30 health facilities were attacked and damaged, and only 4 of the country's 80 hospitals are functioning above 75% of normal capacity. A quarter of health facilities are closed, and an additional 26% are open but can offer no essential services. So there's someone there, but they can't help you, they can't treat you. Only 9% of hospitals in Libya have all essential medications. So you often hear language of Libya, you know, it's in a state of lawlessness, anarchy, it's a country without a state. You hear those refrains quite often. And if you think of a state as an entity that's meant to coordinate, manage, and protect its populations, then in Libya, this failed state framing is very evident in the healthcare sector. So lastly, let's talk about Syria. Syria is a country of 17 million, 13 million of whom require health assistance. Unlike many of its regional neighbors, Syria's population is decreasing, down from 22 million in 2011 when the war began. And this is entirely due to the sheer number of Syrians who have been killed or fled as refugees or internally displaced people. So like Libya, prior to the war, which is so hard to even remember now, Syria was a middle-income country in a period of improving health indicators. And now the life expectancy in Syria has decreased by 20 years since the war began. Due chiefly to conflict-related trauma, nearly 30% of Syria's population report a disability, which is double the global average. A 2016 report found that half of Syria's 30,000 doctors had already fled, and this was 4 years ago, along with many nurses, paramedics, medical personnel of all kinds. One of the defining characteristics of healthcare in Syria has been the frequency of healthcare attacks, which have been in the hundreds every single year. I read a report a few years ago that included an interview with a Syrian fighter, and he said that his group was cautious specifically to not meet near health facilities because that's where they were most likely to be bombed and attacked. Syria is also no stranger to infectious disease. They had a severe H1N1 influenza outbreak in 2009, and they also reported a polio outbreak in 2013 and 2017. And it took a massive global vaccination effort to get those under control. Syria reported its first positive COVID-19 case on March 23rd, Libya on March 24th, and Yemen on April 10th. So far, none of these states have reported a disease cluster greater than 50. I think Yemen says they have 1 positive case total. So I can say with almost 100% certainty that our numbers from these and other fragile states are inaccurate. They're not doing enough testing. If we're not doing enough testing in the US and in Europe, there's absolutely not enough testing in these states. And with these authoritarian regimes, they have an impetus to lie if there is an outbreak or to kind of hide it, especially if it's in a community that's more marginalized. All of these states are low on basic medical supplies like swabs, masks, gloves. They're certainly low on ventilators. They are all lacking in personnel. hospital beds. And if and when a vaccine becomes available, these states don't have the infrastructure to do a massive one-time vaccination campaign once it becomes available. Humanitarian agencies are coordinating emergency responses. They're trying to assist with basic, providing supplies, supporting isolation of infected patients. They're trying to manage the many different NGOs and entities on the ground, but they're not built to respond to pandemics at this scale. This is not what they're made for. To echo Noha's point, aside from, of course, a moral imperative to protect human life, as long as COVID-19 is permitted to run rampant in any country, especially the most fragile, like these three, then no other country can feel completely secure in its own mitigation efforts. Thank you.
Thank you, Yara. And now we will dig deeper into some of those countries more specifically. And I will turn to Afrah. Afrah, we know that Yemen has already been facing a humanitarian disaster. In fact, the world's worst humanitarian crisis, with millions of displaced and millions suffering from malnutrition, food insecurity, and lack of access to safe water and sanitation, in addition to the violence and death. And as Yara mentioned, there's been one confirmed case of COVID-19 in Yemen. How will Yemen, the Middle East poorest country and having multiple domestic and regional warring factions, deal with a threat of a widespread pandemic or an outbreak? What are its unique vulnerabilities in facing this coronavirus outbreak? We heard recently, as I think Noha mentioned as well, that this could bring about a possible end, with giving Saudi Arabia a window to end its war in Yemen. What are we to expect from that? Afrah.
All right. Well, I guess Noha and Yara mentioned a lot of really interesting things about Yemen, and I could be just, I think they've done enough. But what I could add actually is for me, and I think for everybody, should treat the situation in Yemen as if an outbreak has fully arrived. COVID case has been reported only with one person, but I think at this stage, especially that the cases in neighboring countries are growing, I think we have to deal with the situation in Yemen with the assumption that it's in a full outbreak. I think building on some of the points that my other panelists mentioned, I think what is very interesting to try to understand if COVID-19 could change the dynamics of the conflict. And I think it's not as clear as white and black. But I think for the Saudis, as Noha wisely, described how Saudi Arabia has been mastering PR and polishing their image in very, interesting timings. I think it's true. There is an element of PRing in the ceasefire. But I think COVID can change the conflict from the proxy side of the conflict. So for Saudi Arabia, for Iran, for example, these two countries are already struggling internally with their own humanitarian crisis, given the growing number of COVID-19 cases, and also the oil prices and how the economic aspects also having an influence in their own economic national interest. So I could see COVID changing the conflict, from outside, but not necessarily domestically. So while Saudi-led coalition was trying to propose the ceasefire, the Houthis immediately refused to accept the ceasefire. And at the same time, they're still continuing with multi-fronts. So you have one front in Hodeidah, in Taiz, in Sana'a. They're not stopping. Actually, they might take advantage of all the lack of international attention to Yemen and gain militarily more and more territories. And COVID-19 could be, a very, it's a perfect timing for them to have more gains. But some reports are showing that both the Saudi-led coalition and the Houthis, of course, are violating the initial ceasefire, but also at the same time, they resumed talks. So we still don't know what could be the outcome of this confusing, dynamic of ceasefire and talks and still fighting. So nobody knows. What I could only guess is that COVID-19 could, if there is an international political will, could pressure the allies of the warring parties to pressure them to reach some sort of settlement. But given the situation in the UK and the US, like these are the top allies to the Saudi-led coalition, given how they are so busy with their internal COVID-19 crisis, I think that will take some time. But while all this is happening, the humanitarian crisis is not only getting worse. There is no word that I could describe actually how the humanitarian crisis is unfolding in Yemen. Life was already hell on earth for a lot of civilians, with the direct violence, the indirect violence that Yara mentioned, but also like for the most vulnerable communities, like people in detention centers. There are actually secret detention centers that we don't know about. So what about the detainees there? What about the enforceably disappeared people? We don't have an exact number because the numbers are changing and it's massive. And I could just say that every family in Yemen has one enforced disappeared, or at least knows about someone who was enforcibly disappeared. So people in detention, especially in secret prisons, people in IDPs, IDP people in camps across the country. So we have about 4 million IDP people, and they lack the most basic humanitarian assistance. So even toilets, there are so many reports coming from UNHCR where IDP people in so many camps are speaking about lacking toilets. Just take that for a second. Living in the middle of nowhere with nothing, basically. And from my talks, my conversation with a lot of relief humanitarian organization, there seems to be an overwhelmed feeling with the level of suffering and fighting in so many fronts in Yemen. And that is impacting having any kind of joint plan to respond to the assumed COVID-19 outbreak in Yemen. The organization are struggling so much. They are, I think the main challenge for them is that it will be impossible to respond to any humanitarian crisis in the different across Yemen if the fighting and the violence still continuing. So that would just mean like it's suffering and pain and misery for not only the civilians, but also for the humanitarian workers. So the only way, I mean, based on the information that we just heard from Noha and Yara, the healthcare system is already shattered. So the only way to at least contain the suffering of civilians is just to cease the violence and fighting, or at least avoid civilian targets from any fighting. So humanitarian workers and civil society organizations and the civilian and the people can really take care of themselves. Where are the Yemeni government? Where are the political will from the Houthis, the Saudi-led coalition? I think they already have seen so many crises in Yemen, and we've seen that they do not care about the plight of civilians. So I don't see that COVID-19 will change their humanitarian consciousness. Only if their economic interests, only if their political gains are going to be hurt, then they might take COVID-19 as a way to find conflict resolution. Yeah, thank you.
Thank you, Afrah. Again, I'm just reminding our viewers to send their questions through the Q&A feature on Zoom or to the email address events@arabcenterdc.org. And with that, last but certainly not least, we move to Joost, focusing on Libya and Syria. As I think Yara mentioned, there have been several confirmed cases, but so far contained in both countries. Amid this deadly pandemic, what would a massive outbreak look like? How are the political forces responding to the threat, or are they at all responding? Has this affected the conflicts in these countries? Will the calls for ceasefire produce any change? Are you as skeptical as Noha and Afrah and others? And what should the United States and the international community do to address the threats or the potential disaster that could result from an outbreak? Joost?
Thank you very much, Tamara, and thank you to the Arab Center for inviting me and for inviting four speakers who are, I think, all very consistent in their presentation and their perspective on this crisis in the region. I have nothing to say that will lift your spirits, I'm afraid. The COVID-19 pandemic in the region is coming on top of an endemic crisis of governance that has been around for a long time, and that we saw most clearly manifest in the popular uprisings in 2011 and again in 2019. There has been a long history of very poor governance, massive corruption, state inadequacy, and there's many aspects to it. We don't need to go into it, but the current crisis and how these various authorities that are there respond to it is going to add on to the pre-existing governance crisis. It can only get worse. And in fact, everybody in the region is going to look at their authorities, be they states or local municipal authorities or armed non-state actors, whoever controls certain territory, they're going to look at them and see how they perform and evaluate them on their performance. And what may well happen is that people will come to the conclusion after maybe a period when everybody adjusts, because they're sick or because they want to give their authorities the benefit of the doubt, because they realize the odds. But that after that, I think we may well see a return to mass protests because the problems that were there are still there and have in fact become worse. So I just wanted to take you through the three cases. You asked me to talk about Syria, Libya, and Yemen, and I understand Yemen, of course, we now have heard from Afrah, but just to look at the conflict factors there and how that plays out with the arrival of the virus. And I frankly don't know to what extent the virus has arrived. I tend to believe also that the numbers are, first of all, untrustworthy, and second, are clearly understating the extent of the problem. At the same time, we haven't seen mass death yet, and that's something that's very hard to hide. So we also know that the situation is not as dire yet as it is in, as it was in China, as it is in European countries, as it is in the United States. But we also know that if and when the crisis hits full tilt, that, and we heard it from Yara, the health infrastructure and the medical services are so poor that the impact will be magnitudes greater. And we can look at it and say, well, you know, that's there, we're here, but what is there will also come here, because this is a global pandemic, and it is absolutely uncontainable. As I think Noha has said, you know, the virus knows no borders. So we cannot protect ourselves from what will happen in the Middle East or in Asia or in Africa or anywhere else. And so it's not only because of charity that we should look and send aid and try to do the best to prevent a massive outbreak. It is also out of sheer naked self-interest that we should do so. It's good to remember that. Now in Syria, we have a central government that is seeking to recover from a long war, and is still very weak, and certainly doesn't have a health infrastructure that can cope with this crisis. But there is also territories not under its control where the situation is arguably even worse. And in Damascus, the regime is using a securitized approach. It's doing what it knows best under the circumstances and with the capacity that it has, which is to suppress information. And so we will not get accurate information coming from there, but it is also using a securitized approach to reassert the centrality of the state in dealing with the crisis in all of Syria, including in areas it does not control. In other words, if you want to get, if you're living in northeastern Syria, now under control of the Syrian democratic forces, and you want to get, and there's some testing capability, very limited, but you want to get the tests analyzed, you have to send your materials to, the samples to Damascus. And they just don't come back, the results don't come back. Materials are being shipped in by the World Health Organization. The World Health Organization, as part of the UN, is dealing only with central governments. But the materials arrive in Damascus and do not make their way to areas not under government control. And so this is a serious problem. And Damascus is essentially hoping to restore control over all of Syrian territory, not only by military means, but also by simply playing the role of the central state that can determine who gets what, when. And it's also at the same time trying to deflect criticism by saying that in the end it's Western sanctions that are contributing to the crisis, which is objectively true, but it's not the only factor that is playing, of course. In the northwest, where the Syrian Democratic Forces, which is essentially a PKK-led force, is in control, the government is competent and is quite cohesive. And so what they are doing in terms of restrictive measures is quite good. But at the end of the day, it's a territory that is being strangled. And so a lot of the goods that could be arriving from Iraq, for example, and Iraqi Kurdistan is simply not arriving. And in part also because Iraqi Kurdistan itself is deprived of goods because of shipments that are not coming into that territory from outside Iraq. So the situation is very difficult. But for now, it is fairly stable. Northwestern Syria, which is under control of Hayat Tahrir al-Sham, a former Al-Qaeda spin-off, is in a worse situation, not because it's under control of HTS, which has set up a salvation government that is also trying to do its best and which still has a fairly autonomous health ministry, but because most of the health infrastructure has been destroyed in Syrian regime and Russian bombing and bombardments over the past couple of years. There's very little there. And of course, there's all the pre-existing health problems and medical problems that Yara mentioned that are typical for in conflict, where people have to cope with them even without the COVID-19 crisis. And then we have the hundreds of thousands of people who are displaced, sitting in makeshift shelters at the border with Turkey, in very densely packed areas. And if the crisis hits there, for sure it's going to be a tragedy, an absolute tragedy. I didn't mention in the Northeast where you have the displaced people camps, including ISIS families in Al-Hol and Roj camp and other places. You also have large detention centers. Of course, Damascus has its own large prisons just releasing some, but many others stay in prison and also in very, very difficult conditions. So this is clearly a situation that is just waiting to become an absolute catastrophe. There's also the Turkish held areas in the north that where at least people can rely on some Turkish aid, that those borders are open, but generally the situation is very poor. In Libya, just to move on, and I don't want to go on too long, in Libya you don't have huge fragmentation, but you have two would-be governments, one internationally recognized, but essentially a group of militias with a symbolic government topping it, and on the other side a military force that is and an associated government. Both these sides are trying to govern territories, but they have very poor infrastructures, and they are not ending their conflict. At the moment, they are accelerating the conflict. And so they're ignoring any international call for a ceasefire. On top of that, because one side controls the oil infrastructure, the other side has been getting the revenues, which is spreading throughout the country in theory. But because the one side that controls the infrastructure has stopped the oil sales, now there is no oil revenue at all. And the Tripoli government has stopped food imports, and Libya is almost totally dependent on food imports because it was totally dependent on oil for its own revenue. It no longer has industry or whatsoever of any sort. And so now we're facing a real crisis of people, very soon not having access to food. And so again, that is even without the virus spreading like a wildfire, which it may sooner or later. In addition to that, the government in Tripoli has decided to make its funds available, and it has set aside money for dealing with the COVID-19 crisis, to make it available to municipalities. Now, in itself, that is not a bad idea, because in Libya, some of the municipalities, say in Misrata, are acting quite well and are providing services to people. But the health services in these places are not capable of spending the money that they're getting, because they have no access to the importers who would be bringing in the preventive materials that they need in order to protect the healthcare workers, for example. And so what the result has been is that healthcare workers are basically are leaving the healthcare centers. And so now they're not operating, which means that if and when the virus strikes in earnest, people will not have any care to go to. So that's what is happening in Libya. In Yemen, we have, again, a situation like Syria, where there's a fragmentation. You have at least 5 or 6 different areas with different authorities in charge. Some are more tightly controlled than others. The Houthis, Ansar Allah, is strong in Sana'a and surrounding areas, controlling most of the north. And it's operating like most states in the Middle East as police states, and therefore have quite a bit of security capability, and have control of the ministry, the various ministry, including the health ministry, but are otherwise not. I mean, the health infrastructure is also a complete mess. The Southern Transition Council in the south controls Aden, but faces similar problems. The legitimate or the internationally recognized government is sitting in Ma'rib and in Taiz, but is essentially not governing, and is also not imposing or enforcing any movement restrictions at the moment. So. And the fighting is going on. The Houthis have an advantage at the moment militarily, and are using that in order to push back and try to capture Ma'rib from the government forces because of the oil that is there. And so again, there is no heeding of any international call for a ceasefire. The fighting is getting worse, not getting better. As long as the fighting parties see the possibility of making headway militarily, they will do it. And I think one of the reasons we're seeing this in Syria and in Libya and in Yemen is because the virus hasn't hit yet in full force. It is just not acute enough yet for the parties to realize that it is not in their interest to continue fighting, because their fighters will also be affected. And until now, they have not seen that. But that moment will come. But then, of course, it's too late. So to sum up, I think what we're seeing is in fact not a slowing down of conflict, but an acceleration. What we're seeing is that the legitimacy crisis that all authorities, whatever they may be, have faced in the past during the Arab uprisings in 2011, 2019, is going to be compounded by the COVID-19 crisis and not alleviated. And then we have the second order effects of the economic crisis that is going to come on the heels of the COVID-19 crisis, and it's already, of course, coming there, and also the impact of the global economic crisis and economic depression in the world that we see is also going to affect the situation in these conflict zones, and so that will augment the situation. And then we come back to the protests and the violence through non-state actors that will take advantage of increasingly weak state apparatuses, weakened by their inability to respond to the health crisis. And so the situation is, the future looks really, really very bleak. I really would love to give you some points of light, and we can talk about the important work of civil society, as Noha mentioned, and I agree with that. But simply it will not be sufficient to cope with this very serious combination of crises that is about to hit the region in full force, and that will cascade throughout the region and affect all surrounding areas, including us as well. Thank you.
Thank you, Joost. And you know, all of you have painted quite a pessimistic picture, and rightly so. And most of you, if not all, are skeptical of any change resulting from the calls for ceasefire. You've all mentioned the theme of political and economic interests, and the world profiteers, and that as long as somebody's profiting, everyone has so far ignored the ceasefire. And in the case of Saudi Arabia, Noha mentioned the PR stunt using this pandemic for a PR campaign. And as many of you have already also mentioned, nobody really cared for disease or suffering or epidemics in these countries before. Why would they care now? So with this picture, do you have any recommendations? Do you recommend any major policy changes from the United States, the international community, and specific countries involved in some of these conflicts? And I pose this question to all of you. Whoever wants to start, just give me a signal.
Maybe I can start.
Okay, Afrah, go ahead.
Since most of the audience are in the US, I think just start with fixing your own democracy in the US. I think that will, having like a very healthy democracy in the US could absolutely reflect in a global leadership. I think what is missing here is that there is no clear leadership from anywhere, regionally, internationally, even EU. As I am living in Sweden, EU is failing in coordinating with each other to respond to COVID-19. The US is already in a mess. I think what is more threatening to the US than COVID-19 is Donald Trump's destructive policies, especially, you see the impact, the disastrous impact with his lies in this COVID-19 crisis. So I think it's very important that for our audience. I think what is very relevant for our audience is really to look at what is going on at home and try and fix it, because yeah, that will absolutely reflect in the long term. From a Yemeni civilian population needs, I think a lot of relief and humanitarian groups are pleading, saying that cutting funds is not the right time now. So you have the US government, you have even SIDA, the international aid agency here in Sweden, and God knows who else. I haven't fully investigated the matter, but I keep getting the reports and from conversation from humanitarian workers inside Yemen. They're terrified by the timing of cutting funds. So for the donor, the international donor community, it's not the right time now to ditch these vulnerable communities. I think it is absolutely important to have priorities, because even for Gulf countries, for example, if COVID-19 outbreak in Yemen is massively spread, that will backfire eventually to neighboring countries. So it's not a Yemeni issue anymore. It's a regional issue. For so many years, Yemenis have been pleading and saying include Yemen in the GCC. So when such crisis, for example, like now, there could be much coordination, better coordination. But even the Gulf countries are not dealing with the COVID. I mean, you cannot deal with COVID-19 individually. It will not be effective approach. You have to deal with it collectively, regionally, internationally, with a very long-term plans. And I think the donor community here is so vital to vulnerable groups. It's very, very important not to cut funds, even if they have a lot of political issues with this warring party and that. Try and make sure that humanitarian groups can continue working, and also for warring parties to not block access to these humanitarian groups. So we live off the hard work of a lot of humanitarian workers and human rights activists. So we need to support them with every way possible. Thank you.
Thank you, Afrah. And we have quite a few questions coming in that are related. So let me quickly read a few of them before giving the rest of the speakers the opportunity to respond. A question about aid programming in particular. What are the donors doing right and what should they do better?
I think I just replied to that.
Yeah, I think we have a few other questions. I think I'll address this to, I think, Noha, if you can. It's about accountability. How could there be accountability for the handling of the pandemic in these countries? And I mean, and we know there hasn't been any accountability for other things. Do you think being such a global crisis, would there be any difference? Could there be accountability, and how? Noha?
Thank you. I think, despite what I said about how harmful it is to think about coronavirus like it's a war, I was, of course, mainly referring to, the discourse and the analogies and, I mean, and how polarizing that can be. I think that if you look at the coronavirus as though it is a conflict, like an armed conflict, and you think about accountability issues, of course, it's extremely difficult to, pursue accountability in all its forms amidst an ongoing conflict or amidst an ongoing pandemic. But what you can do, and what a lot of people are doing, and what a lot of institutions are doing, is they're documenting. right? So they're documenting, they're reporting about it, they're reporting about the inequalities and the injustices, and they are warning about, you know, the repercussions of just letting these injustices unfold and multiply as this pandemic unfolds and multiplies as well. And so this is why, when in my talk earlier, I wanted to end with, you know, signaling the importance of the work of civil society. And I completely agree with you, Joost, about how, of course, on its own, it's not enough. But I think in this area of accountability, this is where the work of civil society in particular, of course, complemented with supportive messages coming from the international community, I think that is where you know, we can find we can be a little bit optimistic about what, how well prepared we can be to pursue such accountability measures once we are more able to.
Thank you, Noha, and I will turn to Joost if you would like to address the other questions, but also there's one question in particular. What are the international players participating in the proxy wars? Libya, Syria, and Yemen and unconcerned with a potential COVID-19 outbreak in those countries? That's a question for you, and if you'd like to address the other questions as well.
Yeah, I saw there were a couple of questions that were directed at me, and so I'll take those two, and then the one you mentioned. But I think generally what is important is that when you have police states or territories controlled by rebel groups that act like police states in that territory, the response to these kinds of crises tends to be a securitized response. I mean, we even see it in the Western world, but it's especially true in these places. And that has a positive side to it, which is that the enforcement of movement restrictions can be quite effective, can also be harsh. But at least there's that aspect. But of course, it has also a flip side. First of all, the enforcement can be too harsh, can be repressive. There's also the prison situation already mentioned. But there's also the suppression of information. And I think the free flow of information is really critically important in these cases. Because if we don't have accurate information, we cannot make an accurate diagnosis. And then, of course, the cure also, or the way to deal to cope with the crisis is lacking as well. And we've seen this, we don't need to go to the Middle East to see that. We've seen it in the United States, we've seen it in China, we've seen it even in Europe. But frankly, I live in Belgium, there's no testing here. I wish there were. There's only in the hospitals, but you know, you hope not to end up in hospital in the first place. So there's a completely mixed bag, but clearly the capabilities are not utilized and are not available in many cases, and the approach is securitized. Now, I'd say for the international community, at the moment, there's just no attention being paid at all to what is happening in the Middle East. Militarily, countries that are involved militarily are staying involved. Russia stays involved, the United States stays involved, Iran stays involved. Saudi Arabia may withdraw from Yemen, but hasn't yet. It has unilaterally declared a ceasefire, but that's about it. But it said well before the crisis, the virus crisis, that it wanted to get out of Yemen. So, and it's hopefully still acting on it, but so we don't know. But in terms of international help, I want to echo what Afrah said about, the international help has to continue. The European Union is making money available, and that's fine. You can make hundreds of millions of euros available, but in the end, Trump is meanwhile cutting the funding to the WHO, which is terrible news. But in the end, it's not only about the money; it's also about how the money is spent, where the money goes, and whether it's used really for preventive and care, and for the purchase of protective equipment for the health care workers in particular. So the two specific questions, but I would say for the international community, something we said also before the virus, the main thing is not to do any further harm. And I would say that's even more true today. There was a question about rapprochement between the United Arab Emirates and Iran, that we saw some sign of it. We've seen shipments of medical aid from the Emirates to Iran. That's true. Of course, these gestures are not new. The Emirates started last July, reaching out to the Iranians when they discovered that they were highly vulnerable to an Iranian attack. And of course, we have to welcome this. It's a very good thing, but it's also limited, of course, in scope, given the crisis in Iran. At the same time, the Emirates have made very clear that nobody should see this as a foundation for an opening of political talks, because the basic problem hasn't gone away. And from the Emirati perspective, it's the Iran's role in supporting allies in the region. Be it in Syria or in Yemen or in Iraq, and so they need to see something from the Iranian side as well. And of course, so we go back to the basic problem. And so gestures are great. It's all symbolic. Of course, Oman has done the same. Kuwait has done the same. Qatar has done the same with Iran. But that doesn't bring a relaxation of the very severe tensions that we've been seeing over the past couple of years in the region, which are mostly due to the relationship between the United States and Iran. Clearly, there's no let up there. The second question was about infection of potential infection of fighters, be it non-state armed groups or armies, state armies. We haven't, and to what extent there are medical services available. I must assume that states are generally more capable of dealing with this in principle, but the Syrian army is so much weakened by years of fighting that one has to wonder to what extent it can actually do this. I'm not even mentioning the non-state actors in Syria. And the one advantage that military forces have or can have is that they have good internal discipline. So you can enforce certain restrictions. On the other hand, how are you going to fight if you're not fighting together in the trenches? So how do you prevent an infection? And remember the Spanish flu in the First World War. I mean, it was among soldiers where it broke out. And it's almost inevitable. So I think in the end, civilians may suffer the most, but don't think that fighters will be immune to this.
Thanks, Joost. We have a lot of questions coming in and only a few minutes left. So I'll read some of them before I give the microphone to Yara. A question about the next steps for prisoners in Yemen. I'm guessing it's how to make sure they are protected. There is a similar question about the protection of refugees in refugee camps. Is anything being done? What should be done to protect these densely populated people in those densely populated refugee camps? Okay, so I'll stop there and then I'll ask the rest of the questions. Yara.
Okay, well, I think I would defer to Afrah in terms of the specifics of the Yemen prisoners, but just in terms of refugee and prisoner populations more broadly, these are, like I said, the most vulnerable of the most vulnerable. They are kind of claimed by no one often. The prisoners, the services in the prison are very poor. The guards may themselves be infected and the prisoners may not receive treatment. Of course, we've talked about the poor environments themselves are very densely populated, very poor sanitation. So malnutrition, lack of sleep, all of these factors lower the immune system anyway, to the point where they'll be more susceptible to the kind of respiratory virus from COVID. And if there is an outbreak, just like we've seen in nursing homes in the US and in the Western world and in prisons in Rikers in the US, it will spread very quickly, and they are the last priority for service. I just want to go, before I pass to Afrah about the Yemeni prisoners, I just want to briefly talk about the aid issue. And, public health people in these countries, civil society aid people, have been screaming for years that when something like what's happening right now happens, they will not be prepared. They have been saying, they're putting out fires, they're providing emergency food, they're doing measles vaccinations. But they said, if and when the big thing comes, a natural disaster, whatever comes from climate change in the coming decades, an infectious disease, a pandemic, this has been a fear in especially these environments for decades. So I think for me, the lesson for Arab leaders and really all leaders is that you need a strong, cooperative, transparent state that has robust institutions accountable to an empowered and educated citizenry. And until state policies reflect this and they become centered on human dignity and well-being for everybody in your country, and not just the elites or not just the right religious group or not just the right minority, we will continue to see these weak states be fertile ground for infectious disease. Aid agencies cannot make up for a weak public health system. And I think we being the people who are not living in these countries have let this persist. And now it's an emergency. And now we have to spend exponentially more money to just try to contain and keep the death rates down. It would have taken much less money to have proper disease surveillance, adequate stockpiles of medical supplies, even just masks and gloves, true global health coordination. Aid agencies are doing their best in what is an impossible situation. They still have to provide food. They still have to fit prosthetics for that child who stepped on a landmine. They still have to do all the stuff they were doing. And now we're saying it's your job. You're tasked with also dealing with what the most wealthy states in the world can't handle. So really the problem here is war. And I think that until not just the states engaged in war, but the states supporting them. I think just last week, Canada started selling arms to Saudi again in the middle of this. I think that we have to really learn these lessons, and this is going to be a very expensive lesson. And if we don't learn it this time, it will happen again and again and again. And aid agencies will be pushed to capacity. The same things that are keeping us at home right now are having to keep aid workers and aid home. So we can't keep doing this. So from a public health perspective, we need to see conflict as not just a foreign policy decision, but as a daily form of, honestly, terrorism on civilian populations who have no choice and are depending on the outside world for help that comes and, starts and with aid agencies, and it's just simply not sufficient.
I'm just going to give each one of you a minute or a few seconds if you like to give some final remarks. There's a question for Afrah specifically about, none of the actors in Yemen have shown that they're capable of facing problems, but whom do you think is more prepared, I think, to face the infection? Houthis or the Hadi government or the Southern Transitional Council, or help from the UAE? There's another question about the UAE as well, sending medical assistance to Iran, but sending weapons to Haftar in Libya or to other places. And are organizations like the UNHCR fulfilling their mandate in this type of crisis? So I'm just going to give each one of you, if you like, a few seconds to give final remarks. Afrah.
So I'll just be very brief. I think that question, who's better than the other in terms of preparedness, I think every inch of Yemen is screaming of suffering. Nobody is immune in Yemen. So it's not a matter who is more prepared or has more capability than the other, but it's about civilians everywhere in Yemen deserve to be protected and have security and access to health care. So you have even like Yemenis who are enforcibly disappeared to Saudi Arabia. So in Human Rights Watch, recently we published a report about Saudi forces and Saudi-backed forces in Al-Mahra arresting and moving prisoners to Saudi Arabia. We have also other unconfirmed information about Yemenis moved to the UAE, arrested and moved to the UAE. So it's about Yemenis everywhere that deserve to be protected. So it's not a matter of who's more capable. I think It's about all civilians. That should be the main attention. So lastly, what I really want to like, there's so much to say, but I think the last message here that I want to leave with is that please do not forget about Yemen. When everyone is dealing with their own internal, humanitarian health crisis with COVID, every country could come together and come up with policies that could make life better in the long term. So I think it's very important for the international community to not forget Yemen, not ignore what's going on in Yemen. Yeah, thank you.
Thanks, Afrah. Anyone else would like to give some concluding remarks or answer some of the questions? Noha.
Thanks, Tamara. Just very briefly, I think perhaps one way of looking at the escalation in the fighting in Libya in particular, but also Yemen, if we think about, how the international community is fairly distracted at the moment with everybody trying to contain the virus at home, perhaps we can view this escalation as a sort of indication that the recent international efforts to bring the warring parties to the negotiating table in Libya, for example, the Berlin process, Geneva, etc., maybe that had sort of a positive impact in mitigating this upsurge in violence on the ground. This is me trying to be optimistic after our pretty sort of grim presentations over the past hour. So, the message, I guess, to take away from that is, hopefully those same international actors who really do want to bring these warring parties together to come to a resolution to these conflicts should try and get back to it as soon as possible to stop this surge from worsening.
Okay, thank you, Noha. Any more concluding comments, Joost?
Well, because I saw there was another question about the UAE, both sending aid to Iran and weapons to Haftar's forces in Libya, and was there a contradiction? Of course, there's no contradiction. States, and this is not just the UAE, this is true for everybody. First of all, the UAE in supporting Haftar, which officially it denies, of course, it doesn't know that its weapon may be used to hit a hospital where coronavirus patients are being treated. It should realize that this is a great possibility, just like American and British and maybe Canadian weapons going to Saudi Arabia end up being used against civilians in Yemen. So the responsibility is always there, but the contradiction is not, because in the end, states act according to their own perceived self-interest, and it's in the UAE's self-interest in this case to support Haftar, or at least to make sure that whatever political arrangements are made in Libya does not exclude that particular side and marginalizes the Muslim Brotherhood, which is the main target for the UAE. And they want to reach out to Iran because they realize that Iran is a very powerful actor that can do a lot of harm. And so it is acting in its self-interest. But again, every state in the region is doing that, and so is every country that we live in. What we need to do as people working in human rights or healthcare or justice or conflict prevention is to hold our governments accountable for when they are in fact aggravating situations rather than doing no harm. Let's keep that principle up front and remind the authorities that we're dealing with that in fact they have a great responsibility as to what they do in the rest of the world, if not at home.
Okay, Yara, do you want to say something?
Yeah, just to close, first off, thank you again for having me. I just want to say, without the, kind of pie in the sky, what if COVID never existed? A world at peace, we might have still seen a coronavirus 19 outbreak, this COVID-19, we might have still be going through some form of this situation, but we would have been able to respond much more quickly with states that are at peace, that have robust institutions. We might have been able to prevent not all deaths, but tens of thousands of deaths. We might still be in some form of lockdown, but it would not be this uncertain environment of when do we open, what will happen, and which these bad actors is best equipped to handle this. That part was not necessary. So I do hope that out of all this pessimism, we can rebuild the way we approach these vulnerable populations so that this doesn't have to happen like this again.
Okay, thank you, Yara. And with that, we are out of time. We actually went a few minutes over time, and I apologize for that. We had a lot of good questions. Thanks to our great panel of experts for their remarks and their insightful contributions. Thanks to all the viewers who joined us today, and we hope to see you again at the next webinar. For updates, please check our website, arabcenterdc.org. Thank you to the panelists, and thank you, everyone. Goodbye.